So let's look at the written assessment. So again, when you are reading through question and answer choices, even if they're coming from a test bank, mistakes can happen. The wrong answer can be marked, and it's really important that you look at the justification for why an answer is right or wrong, and give that to the students if you can. If this is something like what I utilize for my students a lot of times in Blackboard, is I will put the actual quizzes from the textbook manufacturer into Blackboard, and those don't have to stay secured like the Platinum ones do. So I can provide some feedback to the students there if it's there in the textbook as to why an answer is right or wrong. When you're writing your own questions, stay consistent with punctuation and abbreviations. Organize everything in a logical manner. So if you have multiple questions related to one scenario, put those all together. And then consider cognition and difficulty level. So credentialing exams are going to use questions that require high-level problem solving. And if you're not using these in class, then the student is not going to be prepared to answer them. And we're going to look at a few examples of that here in just a minute. What I mean with cognition and difficulty level is looking at reading level. Okay, so like for EMT, for entry level, a student has to be able to read on an 11th grade reading level, and that's a North Carolina state standard. So either they have to have a high school diploma, proof that they finished in 11th grade English, or have taken some type of testing placing them in that area. And so some of these questions, when you're looking at how they're worded, do have a high cognitive level. So that's something to consider. And then also the difficulty level. Now, for and I just keep using Platinum Planner because that's the system that I'm familiar with. The other one on the market is FISDAP, which I don't have any experience with, but it is set up similarly. But I use Platinum Planner. For example, when you're picking questions there, it will actually show you the difficulty level and how heavily the questions are weighted. And so basically how that's broken down is that it takes into consideration the reading level and the difficulty of the question, but also the difficulty of the answer choices. And so if it is obviously one correct answer and 3 dummy answers or 3 obviously incorrect answers, that's a really low weighted question. If it's, one correct answer, 1 potentially correct answer, and then 2 dummy answers, it's a little bit higher weighted. And then all the way up to the highest difficulty level, which would be 1 correct answer, but the other 3 are still potentially correct answers. And so we'll kind of take a look at this with the cut score and raw score in just a minute, but understand that that's how programs like that and also your credentialing exams are going to be weighted based off of these things. So it's not just simply 100 questions, 100 points. They are actually weighted based off of their difficulty of the question and answer choices. So these are 2 examples of written questions. You have information recall and then problem solving. So let's just take a look at it really quickly. The information recall question says, which of the following parameters is included in the primary patient assessment? And then it gives you 4 choices. So this is a very simple question. It is not asking for a lot of thought process. And while this may have been something that we would have seen historically years ago on our final exam, these are not the kind of questions you want on a final exam now. These questions do have a time and a place, and when you're in those early formative stages of learning, they can be useful. But when you're talking about final exams, unit exams, state exams, these are going to be based more on problem solving questions, something like this. So a patient from a motor vehicle accident presents with decreased level of consciousness, blood pressure of 170/100, heart rate of 60, and a respiratory rate of 10 breaths per minute. The skin is pale, cool, and moist. How should you administer oxygen to this patient? So even though it's only asking you for, a 1-word or 2-word answer here, it is asking you to process all of this information, take it all into consideration, and make a what-if judgment. And that's really what we're asking students to do with these high-level problem-solving questions. And that's the type of questions that you will see on those final exams, unit exams, and state and credentialing exams. Now, looking at time frame for answering questions, it's important that you stick to the same time frame so the student becomes accustomed to this. So I usually give 30 minutes per 20-question quiz. Some of those have matching, some of them have short answer, but usually 30 minutes for every quiz and 2 hours for every test. And the reason that I do 2 hours for every test is because the state exam for North Carolina is a 2-hour time limit, or 120 minutes, and 100 questions. And so ultimately I'm trying to prepare students for that amount of questions and that length of time. And that's why I do that for all of my exams. Now, recommendations are 1 minute per multiple choice question, so 30 minutes for 30 questions, 30 seconds for true or false questions, and 2 minutes for short answer items. So again, just something to consider when you're allotting your time frames, but my best advice is to keep it consistent so that the student is used to how much time you're giving them every time they sit down to take a quiz or exam. Now, looking at grading, again, the raw score, that's what your traditional method of grading is. That's 100 questions is 100 points, so on and so forth. An assigned amount of weight is based on the number of questions. So again, you have 20 questions, that's 5 points apiece, ultimately equating up to 100. The cut score is much different, and again, this takes into account the difficulty of the question and answer choices and assigns the weight to the questions based off of this. So the harder the question, the harder the answer choices, the higher weight. But also you can get points here in some weight for incorrect answers when it's set up like this, because it's thinking about your thought process, not just a right or wrong answer, but your thought process behind it. Why did you choose this answer? Was this the next most potentially correct answer? So it's taking all of those things into consideration when assigning that cut score. Now, this generally helps students. It doesn't hurt them. So with Platinum Planner, when we engage the cut score on here, with a raw score, if you had 100 questions and you got 68 questions right, you would get a 68. With the cut score, and I'm just giving you an example here, if you got 68 questions right, depending on how they were weighted, you might actually get an 85 on the test or the exam. So that's how the cut score works, is based off of the weight, the cognitive ability, and the difficulty of the question and the answer choices. And if you have any questions about that or concerns, please feel free to reach out to me. I know it can be a little bit confusing just talking about it. Now let's look at some psychomotor evaluation. There are usually 3 things that we're utilizing here, and that is skills evaluations, formative, and summative scenarios. So skills evaluations are created to evaluate knowledge and application of one skill or set of skills. Again, this is really low stakes unless it is that gateway for clinicals. Like for my students, I outline that right at orientation. You have to have completed these skills prior to being eligible to go to clinicals on this set date. And one of those things is patient assessment. But for regular, for the majority of their other skills, it's not that way. The skills are not a gateway to anything else. They're simply just there to measure the student's progression. Now, formative scenarios, these can utilize low fidelity or high fidelity simulation mannequins. Low fidelity meaning that it is a mannequin, but it doesn't walk, talk, move, blink, breathe, do anything like that. The high fidelity simulation does do those things, so it can breathe on its own or potentially, create a cardiac rhythm. Those are higher fidelity. Now, either one of these can be used to gain feedback and assess the student's understanding of material, remembering that here in the formative portion, we're trying to give feedback to increase learning and increase the student's ability to adapt and overcome things at this point. This isn't the final. This isn't the end. The summative scenarios are usually done with high fidelity simulation or live patients, and these are high stakes with no feedback given, simply pass or fail. So that's why these students feel so stressed out when going through this final evaluations, because they don't get a lot of feedback. It is simply pass or fail, or maybe not even any feedback at all until the end of the day when they find out pass or fail altogether. Looking at critical failures in the psychomotor evaluation, these should be identified for skills evaluation, but also for scenarios and simulation, both formative and summative. These should be outlined on evaluation sheets and may vary based off of the expectation or the purpose for the scenario. So I'll give you an example for our most recent night ops that we performed with our paramedic students a few weeks ago. Each scenario that was written had its own set of critical failures because each one had its own expected outcomes. So things that should have been done for the patient, and if it wasn't, was that critical or not critical? And this is something that, again, just like with your clinical sense of gut instinct, it comes that way as an evaluator too, looking for critical failures, where you can determine, does the student truly not have an understanding of what's happening? Did they do something to endanger themselves, their own safety, the patient, or their crew? Or was this a minor mistake that we can talk about and potentially do some verbal remediation on? So critical failures are usually going to be some type of life threat to the student, to the patient, or to their crew. Now, looking at remediation, this is the process of analysis and identification of deficits or problems and a plan for retraining or improving performance before retesting. Now, it depends on what it is that you're remediating, will depend on how serious this is. If this is just simply an informal evaluation for a skill checkoff and a student makes mistakes, you would correct them and then they would come back and remediate or recheck off the skill at a later date. Now, looking at more high-stakes remediation, like a final exam or final scenarios, the State Office of EMS says that we can only remediate and offer one redo attempt to students in that case. So usually what I do for EMT, final technical scope of practice, or TSOPs, is when I deliver those results to a student and they have experienced some critical failure that caused them to fail that scenario, I'll tell them what they did right and wrong, so that way they know what to study. So I'll send them home for a few days. I'll let them think about what they did. I don't put them right on the spot. You shouldn't do your remediation or retesting that same day. You really want to give the opportunity to relearn the information, not just regurgitate it. So I'll tell them what they got right and wrong and send them home to, maybe depending on the situation, I might have them write me a paragraph or do some research about it. And then I bring them back their next time to class and we go through it hands-on, and do you have any questions? And then when they're ready, I will retest, because like I said, we can only offer that one attempt at remediation. So if they were to get it wrong a second time, that would be the end of the line for them in the program. So when to remediate? This should follow a student's inability to meet an expected standard during an assessment process, and this could be related to a deficiency in the cognitive, affective, or psychomotor domain. So again, affective is going to be really the hardest to remediate. We have seen some students in the past who had some affective concerns that had to go through clearance, whether that's with a therapist or a psychologist, to get some real answers on the affective side of things and know that they're getting the help that they need. But usually with the cognitive or the psychomotor domain, it's going to be, pretty much how I just described it. Based on the curricula design, the students may or may not be permitted to continue in the program until the remediation is completed and successful reassessment is achieved. So it just depends on where they're at. What are they remediating? Is this one topic? Is this one class? If it's a 2-year degree program, is this the end of the line for a certificate paramedic program? Is this, a clinical thing? Are they about to lose clinical hours or patient contacts because of this? What's happening here? And that's going to make the determination of whether or not they can continue on. And then you need to create some type of remediation plan. So this is a formal agreement made between the student and the instructor with detailed objectives and a date that they must be accomplished by. So the example I've given you here, if a student failed their final exam and let's say they were required to make a 77 on that, I would assign them material like adaptive testing and require a student to complete all 7 tests, making a 77 on each one by a certain date to be eligible to get a second attempt on the exam. And so this is pretty factual. This has happened before. We have students who, let's say they're going to take their final exam. They don't make a 77, which is our required minimum pass. So the adaptive testing feature of EMS testing in Platinum Planner allows them to go in, choose an area in one of 7 categories, and they can take a 30-question or 30-minute quiz. and it's just going to expose them to questions out of the test bank related to that topic or material, and they get a grade on it. So they can pass with a 77 or higher, or if it's less than 77, it would be a failure. So if it was that final exam that they failed and I needed them to be proficient in all material, not just one area, I would assign them all 7 sections or all 7 categories that EMS testing breaks that down into, and ask that they be successful in each one of those before I allow them a second chance to take a final exam. And again, that would be a backup final exam covering the same types of material but with different questions than they were exposed to the first time. And this, if it was TSOPs, I mentioned this before, we would identify the areas where they did well, things that need improvement. We would work with them and then give them one final attempt to retest to see if they're ready or not. So that's going to be it for evaluation methods and remediation. If you guys have any questions about this topic, please feel free to reach out to me and let me know, and I'm happy to help. I hope you have a wonderful rest of your day.